I'm about to tell you something that may completely change how you think about blood pressure. Not because the science is new, most of it has been sitting in peer-reviewed clinical literature for years. But because the conversation you have with your doctor every few months, the one that ends with a prescription refill and advice to cut back on salt, almost never includes any of it. Over the years, I've watched many people faithfully take their medication, follow dietary advice, and still struggle with blood pressure numbers that refuse to improve. The reason is rarely lack of effort. It's usually something else. Blood pressure medication typically targets one biological pathway, but in the human body, especially in older adults, multiple mechanisms can push blood pressure upward at the same time. Today, I want to show you 7 of those mechanisms, and more importantly, simple evidence-based ways to influence them. Raymond was 74. He had been on blood pressure medication for 11 years. He did everything right. He took every pill exactly as prescribed. He went to every appointment. He even eliminated salt from his diet so aggressively that his wife told me he hadn't touched a salt shaker in 4 years. But his blood pressure still hovered between 158 and 166 systolic. 2 medications, perfect compliance, no improvement. When Raymond came to see me for a second opinion, he brought a folder. Inside were months of blood pressure readings, medication lists, and lab reports. He sat down and said something I've heard many times. "I'm doing everything right. Why isn't it working?" And the honest answer was simple. He was doing everything right, but the system he was following was incomplete. Because blood pressure isn't just a number. It's the result of multiple biological forces interacting inside your arteries every second. Medication may address one of those forces, but several others can still be pushing the pressure upward. Raymond and I spent 2 hours going through them. By the end of that conversation, he didn't just have instructions, he had understanding. Today, I want to give you the same list. Most people are told that exercise lowers blood pressure. That's true, but not all exercise affects blood vessels the same way. There is a specific form of exercise that clinical studies show can significantly reduce resting blood pressure: isometric hand grip training. Here's how it works. When you squeeze something, like a grip device or even a rolled towel, and hold the squeeze for about 2 minutes, blood flow in the forearm is temporarily restricted. When you release the squeeze, blood rushes back through the vessels. That sudden rush creates shear stress on the endothelial cells lining the arteries. Those cells respond by releasing nitric oxide, a molecule that relaxes blood vessels throughout the body. The protocol is simple. Squeeze at about 30% of maximum effort. Hold for 2 minutes. Rest for 1 to 2 minutes. Repeat 4 times. Total time, about 12 minutes. Raymond started doing this while watching the evening news. 4 weeks later, his systolic pressure dropped 11 points. One of the most common classes of blood pressure medication is called an ACE inhibitor. These drugs block an enzyme responsible for producing angiotensin II, a molecule that causes blood vessels to constrict. But something interesting appears in clinical research. A plant called hibiscus contains compounds called anthocyanins that also inhibit the ACE enzyme. Several studies have shown that strong hibiscus tea can significantly reduce blood pressure in people with hypertension. Preparation matters. The studies typically use 2 to 3 grams dried hibiscus flowers, steeped 10 to 15 minutes. Raymond added a cup of hibiscus tea each morning. He didn't love the tart taste at first, but after a couple weeks it became part of his routine. Most people associate sunlight with vitamin D, but sunlight influences cardiovascular health in another way that many people don't know about. Your skin stores a compound called nitrite. When UVA light hits the skin, it converts that stored nitrite into nitric oxide, which enters the bloodstream and relaxes blood vessels. This process can lower blood pressure for several hours. Research suggests that about 20 minutes of midday sun exposure on the arms and legs can activate this pathway. This doesn't mean prolonged sun exposure. It simply means short, purposeful exposure that allows this nitric oxide release to occur. Raymond had avoided sunlight for years. When he started taking short midday walks again, it became one of the easiest habits in his routine. Most blood pressure advice focuses on reducing sodium, but that's only half the equation. Inside the smooth muscle cells of your arteries are tiny molecular pumps called sodium-potassium pumps. These pumps push sodium out of the cells and pull potassium in. When potassium levels are low, these pumps don't function efficiently. Sodium accumulates inside the cells. Water follows sodium. The cells swell, narrowing the blood vessel. Blood pressure rises. In other words, sometimes the problem isn't too much sodium, it's not enough potassium. Potassium-rich foods include avocados, leafy greens, coconut water, beans, potatoes. Raymond began adding half an avocado to breakfast and more greens to meals. Within weeks, he noticed gradual improvements in his readings. Uric acid is usually discussed in connection with gout, but elevated uric acid can also interfere with blood pressure regulation. High uric acid can disrupt the endothelial nitric oxide synthase enzyme, which normally produces nitric oxide in blood vessels. Instead of producing nitric oxide, the enzyme begins generating oxidative molecules that damage it. Raymond's uric acid had never been tested. When we checked it, it was 7.8 milligrams per deciliter, above optimal levels. As it came down over the following months, his vascular function improved as well. This is why asking your doctor to check uric acid levels can sometimes provide useful information. Your arteries contain pressure sensors called baroreceptors. These sensors communicate with the nervous system to regulate blood pressure. But chronic stress can keep the sympathetic nervous system, the fight-or-flight system, partially activated. That keeps blood vessels slightly constricted. One technique that can influence this system is slow breathing at 6 breaths per minute. That means inhale for 5 seconds, exhale for 5 seconds. This breathing rhythm stimulates the vagus nerve, activating the parasympathetic nervous system. The result can be a measurable drop in blood pressure within minutes. Raymond tried this once in my office. His blood pressure dropped 13 points in 4 minutes. He looked at the cuff and said, "That feels like a medication." The final mechanism involves something surprising: bacteria on the tongue. Certain oral bacteria convert dietary nitrates into nitrites, which later become nitric oxide in the stomach. One of the richest natural sources of nitrates is arugula. But there's a catch. The nitrates must mix with saliva during chewing. If arugula is swallowed quickly or blended into smoothies, the process doesn't work as effectively. There's another factor. Antibacterial mouthwash can kill the bacteria responsible for this conversion. When Raymond stopped using antibacterial mouthwash and began eating a small arugula salad each day, it added another source of nitric oxide support. 3 months after our first conversation, Raymond returned to his cardiologist. His systolic blood pressure was 138, not a single lucky reading. His home readings had been consistently between 135 and 142 for weeks. For someone who had spent years between 158 and 166, that was a major change. His cardiologist reviewed the list Raymond brought. After reading it, he said something interesting. "I know every one of these mechanisms. I just never put them together in a single conversation." Not because the science didn't exist, but because most appointments simply aren't designed for that level of explanation. Blood pressure management is rarely about one single factor. It's usually the result of multiple biological systems interacting at once. Medication can be important and often necessary, but understanding the underlying mechanisms gives you the ability to have a more informed conversation with your doctor. If you've been managing blood pressure for years and your numbers still aren't where you'd like them, it may be worth asking about vascular function, uric acid levels, lifestyle factors that influence nitric oxide. Sometimes the most powerful improvements come from addressing several small mechanisms together, just like Raymond did.